Hey everybody, Dr. Amy here with Fortress Physical Therapy. Today we're going to demonstrate how I like to apply cupping to a particular body part. So today we're going to focus on just the shoulder blade complex area. And how I like to have this set up is I like to have the patient completely relaxed, right? Because think throughout the day, we're constantly moving our arms and our body, so we're actively engaging our muscles. So it's time to let these muscles relax and get a little bit of TLC. So two different types of cups that I like to use on patients is I have this nice little pliable silicone cup, and I like this in particular, especially when a patient comes in and, we're working on particular, maybe a bony part, maybe over an elbow area, or even some aspects of the shoulder complex, because sometimes you can really feel the shoulder blade. So by applying the cup, I just squeeze it, and then it basically creates a negative pressure and it attaches to the skin of the patient. And I like the rubber cupping or the silicone cupping because I can easily move this around. I can kind of give little turnies, right? It kind of feels good on the patient. And as I'm moving this cup around, I'm feeling through the cup with my fingers that there might be a particular area that kind of feels, what I like to say, gristly. And that might just indicate an area where we might have to spend some time. Now, you might think, oh my gosh, cupping. Oh yeah, the red marks, people may experience or kind of have an effect of like these little hickeys that kind of show up on the body after someone gets a bout of cupping performed. And I'll explain that in a little bit, but really the cupping aspect is we're bringing that blood flow to the surface. Okay, and we're moving that blood around, and I can feel right now, I can feel from my patient here that there's heat coming off from her at the moment. And she has a little bit of gristliness here in this, what I call this infraspinatus muscle, which is part of the rotator cuff complex. So now I'm going to demonstrate, I'm going to switch to the other cup that I particularly like and like to leave that in place statically in order to really suck this blood up to the surface and try to create and stir up some what we call a little bit of like good inflammation, good heat to the surface. All right, this is just a plastic cup and it has a little pump on the end, and this is my pump. So you can already see a little bit from Anne-Marie's shoulder. She has some more redness that's showing up, so that may indicate an area that we might have to spend a little bit of time on. Does that mean pain is coming from that area? Maybe, maybe not, but that would require further assessment. So I like to, whoops, I'm not going to outtake that. I like to kind of give little two pumps. I like to create a lot of suction. She can really feel that right now. So usually I'll kind of set the cups up in particular areas around the shoulder complex and let the patient kind of marinate on the cups for somewhere between 5 and 10 minutes. I can, if I wanted to, I can still rotate the cup on here. But I like, especially with the plastic cups that are solid, as you saw as it hit the floor, that creating just a stable environment into that area that's in question. So now this leads to the actual, perhaps the hickey that may develop. So I always like to tell patients that, we go out in the cold and then our cheeks get very red or rosy, right? Because blood's trying to get to that surface and re-warm our cheeks. Same concept that's happening here. So our circulatory system has arteries, capillaries, and then veins. The capillaries, where the arteries and veins come together, capillaries, that's actually where oxygen and CO2 is exchanged. So essentially, we're bringing those capillaries to the surface and we're actually causing them to burst. Now, it might sound be like, oh my gosh, you want capillaries to burst? But think of this. This is the concept. We still don't know the true mechanisms of what cupping does, but this is the thought. You bring those capillaries to the surface, they burst. Well, your body is an amazing machine, so it remakes it new capillaries. So if it remakes new capillaries, guess what? We're enhancing blood flow. We're creating a better connection between deoxygenation or CO2 with oxygenation, and we're creating a better connection there. So then in turn, the thought is the more red or purpley the area is, perhaps that might be, again, the area where we may have to concentrate on for treatment. And then all I do is just pull up on the little tab, and that's pretty much it.